Well, Jackie, testing, it's been a headache for healthcare providers, for public health officials. Ever since the start of this pandemic, we've documented the shortage in supplies and the lags in when you take a test and when you can report the results. The good news is a lot of those problems, we have overcome them in Pennsylvania and in the Philadelphia metro. And now public health officials say they are turning toward preparing to deliver a vaccine.
Are you ready, Miss Minnie? I'm going to do this one. All right, here we go.
Since the start of the pandemic, we've stayed in touch with Philadelphia nurse practitioner Tarek Khan.
Perfect. You did great.
You know, so since we talked, Mitch, actually things have gotten better with testing.
In April, we watched his clinics fight for testing supplies. In May and June, we watched him test patients. Back then, it was taking up to 2 weeks to get the results.
It may as well have been that we didn't have testing at all.
The problems traced back to the two biggest national labs. They were overwhelmed with new COVID cases coming in from the southern and western states. Quest Diagnostics was experiencing week-long lags, but in a statement to NBC10 said in part, we now have ample capacity to accommodate incoming orders.
We have a much more real-time view of what's happening with the epidemic, and we can respond to any changes that we might see.
Wednesday, real-time tracking from tests and contact tracing helped the Philadelphia Department of Health identify a 9-person outbreak tied to a church on Torresdale Avenue. With testing problems behind him, Philadelphia's health commissioner is turning attention toward 8 different vaccines, now in the final trial stage.
There are factories that are out there producing the vaccine now in the hopes that the test will show that they're effective. And the moment that they're found to be effective, then we can start deploying them.
Dr. Tom Farley told us logistically vaccination will work much like testing. Your doctor, pharmacy, or drive-through clinic can handle the shot. The most medically vulnerable will get vaccinated first, but doctors and nurses say they're concerned if the public will trust a vaccine.
That's really the only way that we can get back to normal is if we have a vaccine.
I don't know how long it's going to take us to vaccinate enough people to where we feel like we have control over the epidemic and we can throw away the masks. That day is going to come, but I don't know how long it's going to be.
And Philadelphia's health commissioner, he says he's hopeful that a vaccine will actually be in distribution in Philadelphia in the early months of 2021. Even without a vaccine, looking at the rate of positivity, it's about 4%. It continues to hover around 4% in Philadelphia. Think about how far we've come. Back in April, out of all of the tests that were taken in Philadelphia, about 44% of them were coming back positive for COVID-19, Jackie.
We have to continue to remind ourselves of that. Mitch, thank you.